morning, everybody. We were on earlier and told you that some of the things we're going to cancel and push back until October the 6th, and it's due to the other two commissioners waiting test results for COVID. So I have invited Dr. Stewart to give us a brief update on what's going on, and Amy's going to cut this and use it different ways. So I'll tell her all about that here in a little while. Okay, so Dr. Stewart, it's up to you. Go ahead.
I'm Dr. Anita Stewart with the Fayette County Health Department. Thank you for having me this morning. So if you're not aware, we are in a significant surge of COVID-19 cases here in Fayette County. This is happening across our entire state. We have the fastest rate of rise that we've seen during the last 18 months of this COVID-19 pandemic. We're seeing upwards of 260 to 300 cases a week, which is record highs for us in the last 2 weeks, which is anywhere from 60 to 80 cases a day, sometimes more. This is over the weekend, we had 130 cases in the weekend. We're seeing record numbers of pediatric population, 0 to 17 test positive, with the highest numbers being in the 5 to 11 age group, which are the ones that are ineligible to be vaccinated at this point. Right now, our hospital systems are working very hard to maintain capacity. However, due to staffing issues, we are struggling. We are having to hold patients in the emergency department waiting for beds. Patients are being transported out of state. We flew someone to Pittsburgh yesterday and the day before. We are typically on at least a 2 to 3 day wait at tertiary care facilities. So this is not just for COVID related care. This is for care associated with heart attacks, strokes, traumas, other surgical complications, things like that that we would need further care for. So please note that we're not immune to that here. In fact, we're seeing increased pressures in our system related to that. So what I'm asking our community to do is if everyone really needs to do their part to help slow the surge. Things that you can do to slow the surge are, number one, to get vaccinated. So if you've not been vaccinated yet, it's not too late. We have vaccinations available at the health department Monday through Thursday, 9 to 3. You can walk in and get them. All of our federally qualified health centers and local pharmacies have vaccinations. So please, you can go to vaccine.gov, vaccinefinder.gov if you're looking for a certain type. Find out where they are and go get them. We know that they work very well at preventing hospitalization and death. And so of our hospitalized patients across West Virginia, those that are in the ICU, 90% of those are unvaccinated. So what we know is that vaccines do work. They're doing a good job at what they're designed to do. Okay. Other things that we can do is to wear masks when we're indoors. And we can wear masks when we're in crowded outdoor areas. Okay, so if you're in the stands of a football game, or if you're on the sideline somewhere, we should be wearing masks to help protect one another. Okay. Other things that we can do are wash our hands, stay home when we're sick. So if you feel sick, if you have allergy-like symptoms, sinus symptoms, nausea, vomiting, any of those things, you would need to get tested. We would encourage you to get tested and stay home until you get your results. There's testing sites all over our county. We have great partner support doing testing. So please find one of those sites. Other things that you can do is, avoid large gatherings, make good choices for your family and our community to help keep us safe. Being in well-ventilated spaces, opening the windows if you're in an enclosed space. Those are all things that we can do to keep ourselves safe.
I know Dr. Stewart and Terry are our person who takes care of our health department. Helped me through a lot when I was going through my COVID. I actually thought that I had a sinus infection And I said, Terry, I have a sinus infection. Do you think maybe I should get tested? And she said, you get down there right now. And I hopped in the car and drove. And she said, well, I didn't think you'd get here this quick. But I did. And actually I tested and I did have it. I had 2 rough nights, but then after that, it was just, slept 18 hours one day. It was pretty nice. But now I have this bad habit of 2 o'clock. I think that I need to take a nap. So I need to break that. But she's correct. There's a lot of COVID right now going on in our area. What more of a period do you think? Maybe up to 4 weeks we may be experiencing it?
So I think our numbers right now, they're predicted to continue to rise through between the 20th and 26th, or what the models are predicting. But remember, hospital capacity will still be stretched 2 to 3 weeks past that peak. So our healthcare workers are tired and are spread very thin right now, and we're understaffed. They're doing the best they can to take care of you. They are working really, really hard for you. So we all need to do our part to help support them in this. And that's to slow the surge, slow the spread, so we're not overwhelming our hospital systems.
Yeah, and our healthcare workers, including the ambulances, they've done amazing. And without them, we would be really hurt in our county. So it's a win-win situation. If we do the things we're supposed to do, be spread apart, wear your masks, wash your hands, do everything you can to prevent it from happening. And don't be like some people said that it'll never happen to me, because it will. I used to think, well, if. Now it's not if, it's when. And I'm very thankful that I did have the vaccination, because I know what I went through for 2 days, and I would not wish that on anyone. So Dr. Stewart, Terry, thank you very much for both what you're doing. It means a lot to the county, and it means a lot to our healthcare providers also having you out leading in the front. So we deeply appreciate it. Thank you for what you do. Same thing with all of our other healthcare workers and with our ambulance personnel. We really appreciate what you do. So thank you. And anything else you'd like to add? My father, so. No. Terry, anything you'd like to add? Okay, testing today at?
So testing today is from 10 to 2 at our soon-to-be open location on Maple Lane, which is behind that Express. We'll also be there tomorrow 10 to 2 and Friday 10 to 2. They're also testing tomorrow at Smithers, between the between Valley Pre-K 8 and the Gateway Center from 3 to 6. River Health is testing every day 9 to 3. Reno Medical Center is testing every day. All of their sites. Access Health is also testing. So please, we're asking people, if you do need a test, do not go to the hospitals or to the urgent cares unless you're ill and need to be seen by a healthcare provider. We encourage you to go to one of the free testing sites first.
Yes, please go. And if you're feeling rough, please get tested and don't go out. Okay, thank you, ladies, very much.